If you're over 60 and waking up without an erection or finding it hard to maintain one, it's not just a natural part of aging. It's a signal from your body about your blood flow, muscle strength, and overall health. Ignoring it doesn't just impact your intimacy, it can drain your confidence, sap your energy, and even signal risks to your heart health. Erectile dysfunction, ED, isn't just a bedroom issue, it's a warning of deeper changes that can affect your entire well-being. But here's the empowering truth. You can often reverse it without relying on pills. I'm Dr. James Carter, a urologist and men's health specialist with over 30 years of experience helping men in their 60s, 70s, and even 80s regain strong, natural erections and a sense of vitality they thought was gone forever. Many men chase testosterone boosters or medications, overlooking the root causes of ED, weakened pelvic muscles, poor blood flow, and chronic stress. In this video, I'll share 4 powerful exercises designed to restore circulation, strengthen critical muscles, and revive sexual function naturally. The 4th exercise is so rarely discussed yet so effective, it might completely change how you approach your health. Before we start, if you're committed to aging with strength, confidence, and joy, please subscribe and turn on notifications to get science-backed tips tailored for men over 60. In the comments, type 1 if this resonates or 0 if it doesn't. I'm here to listen and improve. Let's dive into the first exercise, which targets the foundation of your sexual health. Exercise 1. Pelvic floor strengthening, Kegels for men. I'll never forget a 67-year-old patient who came to my clinic feeling broken. "I still love my wife," he said quietly, "but I don't feel like a man anymore." His erections had faded gradually, and medications only frustrated him further. After 8 weeks of a simple daily practice, he returned with a spark in his eyes. "Doc, I feel alive again." That practice was pelvic floor strengthening, known as Kegel exercises. Many assume Kegels are only for women or bladder issues, but for men over 60, they're a cornerstone of sexual health. Your pelvic floor muscles are the unsung heroes of erectile function. They control blood retention in the penis during an erection, acting like a valve. Strong muscles trap blood in the erectile chambers, ensuring firmness. Weak muscles let blood leak out, leading to soft or short-lived erections. As men age, these muscles often weaken from inactivity, especially if you've never trained them. But with consistent practice, you can rebuild their strength, improving erection quality, sexual stamina, and even confidence. Research, like a 2018 study in urology, shows Kegels significantly improve ED in older men, with many reporting results within weeks. Here's how to do it. Find a quiet spot to sit or lie down undisturbed. To locate the pelvic floor, imagine stopping your urine midstream. That subtle internal squeeze is your target. Avoid tensing your abs, thighs, or glutes. It's an inner contraction. Squeeze the pelvic floor, hold for 5 seconds, then relax for 5 seconds. That's 1 rep. Start with 10 reps, 3 times daily, morning, afternoon, evening, taking less than 2 minutes per session. After 2-3 weeks, increase the hold to 7-10 seconds as your endurance grows. Within 4-8 weeks, many men notice harder erections, better control during intimacy, and stronger climaxes. One patient even said, "It's like I turned back the clock 10 years." This exercise is simple but profound. It requires no gym, no equipment, just commitment. It's not just about function, it's about reclaiming control over your body. If Kegels strengthen the foundation, The next exercise unlocks the blood flow that fuels it. If this is resonating, comment 1 below to let me know you're with me. Exercise 2. Diaphragmatic breathing for blood flow and calm. A 71-year-old patient once shared his struggle. I want to be close to my partner, but my body won't respond and my mind's racing. He didn't realize that years of stress and shallow breathing were sabotaging his erections. Chronic tension keeps your body in fight or flight mode, constricting blood vessels and reducing pelvic blood flow, the lifeblood of arousal. Diaphragmatic breathing, or deep belly breathing, can change that. It's deceptively simple, but scientifically proven to boost erectile function in men over 60. Deep breathing activates your parasympathetic nervous system, shifting you into rest and digest mode. This lowers cortisol, relaxes muscles, and opens blood vessels, increasing circulation to the pelvis. A 2020 study in the Journal of Sexual Medicine found that breathing exercises improve ED by enhancing vascular health and reducing anxiety. This practice not only supports erections, but also helps you stay present during intimate moments, easing performance pressure. Here's how to do it. Find a quiet space to sit or lie down comfortably. Place one hand on your chest, the other on your belly. Inhale slowly through your nose for 4 seconds, letting your belly rise, not your chest. Hold for 2 seconds, then exhale through your mouth for 6 seconds, feeling your belly fall. Repeat for 5-10 minutes, twice daily, morning to start your day, evening to unwind. If you feel anxious before intimacy, do this for 2-3 minutes to relax. Patients who practice this report feeling calmer, more connected, and more responsive. One man said, "It's like my body finally remembered how to relax." This exercise is a foundation for the next one, which directly targets penile blood flow with a tool used in clinical settings. Breathing sets the stage. Now, let's wake up your vascular system. Exercise 3. Vacuum pump therapy for blood flow restoration. I once introduced a vacuum pump to a 65-year-old patient who laughed nervously. "You're kidding, right?" He was skeptical, even embarrassed, after years of failed pills and fading confidence. 3 months later, he walked into my office beaming, "I'm getting erections like I did in my 50s, doc." Vacuum pump therapy isn't a gimmick, it's a clinically proven tool used in hospitals, especially after prostate surgery, to restore natural erectile function. For men over 60, it's a game changer. As we age, blood flow to the penis slows due to narrowing arteries, inactivity, or conditions like diabetes or hypertension. This weakens penile tissue, reducing elasticity and making erections harder to sustain. A vacuum pump counters this by using gentle suction to pull blood into the penis, expanding vessels and mimicking natural arousal. Over time, it retrains your body's vascular system, improving circulation and sensitivity. A 2019 study in BJU International found that vacuum therapy improved erectile function in 70–80% of men with mild to moderate ED. Here's how to use it. Choose a medical-grade vacuum pump, manual or battery, operated, for safety and reliability. Apply water-based lubricant around the cylinder's opening for a tight seal. Insert your flaccid penis, hold the base firmly against your body, and pump slowly to create suction. Within seconds, blood will flow in, creating an erection. Hold for 10–30 minutes, 3 times a week. Some men use a soft constriction ring to maintain the erection briefly. Consult a doctor for safe use. Never exceed 30 minutes to avoid discomfort. After 6–12 weeks, men often report stronger erections and better libido. One patient said, "I didn't think I'd feel this again." Combined with Kegels and breathing, this exercise rebuilds your erectile system naturally, offering lasting results without medication dependency. But the final exercise takes a different approach, addressing tissue health and psychological barriers. Exercise 4. Penile tissue massage and mobility and confidence. A 69-year-old patient once told me he felt like half a man after years of ED. "I tried everything," he said, "but I still didn't feel whole myself." When I introduced him to penile tissue massage, he was hesitant, worried it sounded strange or ineffective. But after months of consistent practice, he reported not only stronger erections, but also a renewed sense of connection to his body. "It's like I'm not just functioning, I'm proud of myself again," he said. Penile massage is an overlooked technique that improves tissue elasticity, enhances blood vessel health, and reduces psychological barriers around intimacy. Aging can cause microscarring or stiffness in penile tissue, limiting its ability to expand during arousal. Gentle massage stimulates blood flow, promotes tissue flexibility, and can ease performance anxiety by normalizing touch. A 2021 study in sexual medicine found that manual techniques improve penile health and confidence in men with ED60. Here's how to do it. In a private, warm space, for example, after a shower, apply a natural oil, like almond or coconut oil, or lubricant to your hands and penis. Start with light, circular strokes along the shaft and base, avoiding excessive pressure. Spend 2-3 minutes, 3-4 times a week, focusing on relaxation, not arousal. Visualize blood flowing freely and tension releasing. This isn't about instant result. It's about conditioning your body. Over time, men report increased sensitivity, firmer erections, and less shame around their bodies. One patient said, "It helped me see my body as an ally, not an enemy." This exercise is unique because it bridges the physical and emotional. It's not just about function, it's about reclaiming confidence and comfort in your own skin. Combined with the other exercises, it creates a holistic approach to ED. Overcoming barriers. Addressing shame and stigma. For many men over 60, ED carries a heavy emotional weight. Cultural messages or past experiences may make you feel that sexual struggles are shameful or that seeking help is weak. I've had patients say, "I was raised to believe men don't talk about this," or "I thought I was too old to care." But let me be clear, your desire for intimacy, confidence, and health doesn't expire with age. ED is a medical issue, not a reflection of your worth. These exercises empower you to take action without judgment. If you're hesitant, start small. Try Kegels in private or 5 minutes of breathing to ease into the process. If you feel embarrassed about tools like vacuum pumps, know that they're used by thousands of men worldwide with life-changing results. If you have health concerns, for example, heart conditions, consult a urologist to ensure safety. You're not alone. Millions of men face ED, and the first step is choosing to act. Conclusion: your path to vitality starts now. Thank you for joining me in this honest, science-backed conversation. If you're over 60 and struggling with erections, these 4 exercises can address the root causes of weak pelvic muscles, poor blood flow, stress, and tissue health without the side effects of pills. Pelvic floor strengthening rebuilds the foundation of your erections. Diaphragmatic breathing enhances circulation and calm. Vacuum pump therapy retrains your vascular system. penile massage restores tissue health and confidence. Together, they signal to your body that you're not done living, loving, or thriving. My 30 years as a urologist have shown me that the greatest transformations come from consistent, intentional steps. I've seen men in their 70s and 80s rediscover intimacy, energy, and pride they thought were lost. One patient told me, "This didn't just save my marriage, it saved me." You're not defined by ED. You're a man with the power to reclaim your vitality. Start today. Try 10 Kegels, 5 minutes of deep breathing, research a vacuum pump, or begin gentle massage. In my next video, I'll share a 7-second daily habit to amplify these results and a full routine for men over 60. Comment 1 if you're ready to take charge, or 0 if this doesn't resonate. I'm listening. Let's make this chapter of your life strong, vibrant, and unapologetically yours.